Hello, everyone, and thanks for the invitation to this quantitative imaging workshop, 19th edition. I'd like to thank Ray Avila for invitation and all the board, including also Jim Mulshan and other people. So my name is Mario Silva. I'm a radiologist based in Italy. And I'll be here talking about this exciting new topic. It's new CT technologies with new opportunities. Thing here is that we are going to have a new definition of CT imaging in the next years, actually already on the ground since a couple of years or so. So these are my disclosures. So the thing here is that we're moving from a type of detection of the energy, which is the old energy integrated detector, which used to detect the photons, the X-rays, directly on a detector. But this was limited because some of this information was lost. And of course, and most of all, the granularity within this information was not achievable. We're now moving to a new type of detector, which is called photon counting detector. And basically, this new kind of detector is able to take all the information from the X-rays and to modulate it into different energies coming to the detector itself. So there is a advantage in the energy, which is because this includes all the photons up over a certain threshold. Below that threshold, everything is considered to be noise, actually. So we get more energy at our detectors, but also we get sub-pixel imaging, so we get to a better resolution of the image. So more energy detected with less noise and more detail. This is very important to remember. And this is also very important because with this new detectors, we can have a good efficiency of the image quality throughout the energy levels, which is opposed to the energy integrated detectors that had increasing responsivity of the detector as the energy increased. So with this technical concepts in mind, we can say that we have now a improved ability to detect the signal, and this improved ability translates in abutting the noise and in being able to evaluate the energy that each photon is putting into the subvoxel detector. And as the quite complicated mechanism of a photon counting detector is based on, basically we can have discrete thresholds, and here you can see the exemplified the threshold of kilo electron volt equivalent below 25, which is considered noise, and then at steps of about 25 kilo electron volt. And for along these 4 steps, you can recognize 4 different chromatic features of the energy that is assumed there. What does this thing means? So better efficiency of the detector, less noise. Whatever is below this threshold of 25 is not detected, and this is very good for quantitative imaging, excellent for quantitative imaging. This also reflects in less streak artifacts and more stable CT numbers, therefore. So we have a first achievement with better image quality, with lower image noise, even at lower dose. And this is very important. But on the top of that, we're getting also simultaneous readout of the CT data in different energy beams, which means a spectrally resolved measurements. So we don't just have quantitative biomarkers with density anymore, but we have spectrally resolved measurements all over for any acquisition that we do with this kind of technology. So let's see what literature already said about these things. We can use photon counting detectors for reducing the dose, as we said before, in different settings, in lung imaging, especially because the substrate, the anatomical substrate is great for that. What the literature brings to us is that's the photon counting CT with a dedicated iterative reconstruction, quantitative reconstruction, quantitative iterative reconstruction dedicated for photon counting images gives you a much better image quality at lower dose, as you can see in this example from the paper from Voltaire et al., published in Diagnostics this year. Another example from the literature comes from investigative radiology. And this is actually already in press. And if we can move a bit further from the quantitative evaluation, we can also appreciate here how the photon counting with dedicated reconstruction also improves the visual detail of interstitial findings. And this is reflected in improved reader confidence in the diagnosis of a disease such as the usual interstitial pneumonia, where you have to have reticulation, ground glass opacities, and also mosaic pattern in some areas as it might be defined. So quantitative improvement, but also visual improvement, we're taking it all with just one new technology. And also another paper which is based upon radiation reduction and image quality maintenance, as this paper from Zurich. Actually, sorry, this is from the authors from the US. Sorry for the mistake. And in this paper, they could show that a reduction of 66% of those was visible in for reading images with usual interstitial pneumonia again. And this is so important. Also, if you look at this very, very faint ground glass opacities that you can see in this 66% reduced image on the bottom right image there. Again, we move to the other possibility here, and you can see that the spectrally resolved measurement can be useful for several things. One excellent example from the literature that comes in help to us is the virtual non-contrast images that you can see here. All of us quantifying emphysema struggle with the different numbers when the contrast enhances the lung parenchyma. If we acquire contrast enhanced images with photon counting technology, we can do virtual non-contrast, we can still quantify confidently and consistently the emphysema. And you can see the difference from a arterial venous phase without virtual non-contrast, contrast enhanced, and with virtual non-contrast, which becomes more comparable to a true non-contrast image. And this paper was published in British Journal of Radiology this year again. Other examples about virtual monoenergetic and evaluation of contrast, because we want to do reconstruction in virtual monoenergetic to improve the detection of contrast in arteries. And we still want to have a good reading for the emphysema. And this is one of the most advanced paper where the monoenergetic reconstruction was compared with the Bertillon contrast to assess a good middle way between the perfect monoenergetic for emphysema, for pulmonary embolism, and the most appropriate threshold for emphysema. And here you can find that the best trade-off was seen for 60-70 kiloliters per volt. So I hope I've opened some topic for the discussion for the next session. And let's enjoy the discussion with big experts from all over the world here. Thank you.